good point. It's good that you mentioned the travel ban. Every time, every day, notwithstanding, as you said, wala pa naman tayo na nakikita. It looks like it's holding. But every day we get reports of, oh, mukhang itong country na to, idadagdag na rin. Itong country na to, idadagdag na rin. How far do you think we have to go? I mean, will it get to the point that there will be a total ban on flights, or how much further does considering that it could come from not just directly from the UK or Europe, it could come via any transit point. How far will travel bans have to be considered?
Yeah, you know, the strategy to control a new virus, just like what we did when the SARS coronavirus 2 started, is really port control, port of entry control. But once it is actually already identified in the country, the efforts now shift, not just with the air entry control, but also what is being done inside to prevent its spread. And with or without the variant, we really have to be even stricter with the enforcement of what we call minimum health standards. It really has to be enforced, especially now that we have reports of variants which are maybe more infectious. As I said, based on the current studies that are being done, are actually more infectious than the current strains that have been reported. So we really have to practice the minimum health standards, and that will be, as of now, adequate, short of the vaccine, to prevent further spread.
Okay, if we establish that the variant is here, do we need to tighten restrictions like the other countries are doing? They return to lockdown. So nang kinatatakot ngayon ng mga tao that we might have to close businesses again, we might have to limit movements again. Is that possible?
The possibility is, and I don't know whether lockdowns will be imposed, but that will really depend on if there's a sudden increase in cases, for example, which is very significant on a daily basis, or if for some reason people are developing more complications, developing more symptoms, more severe symptoms over a certain period of time, more patients are being affected, maybe that will be considered. But as of now, as I said, it is proven to be more infectious, but has no impact so far on severity of symptoms or even severe consequences like death. So it has no effect on those so far.
Doctor, I think the concern arises from what the experts say is that it's highly infectious. Okay, here's Robbie Alampay coming in.
Good evening, sir.
Infectious, and from what we read in the news reports, it has forced governments, especially in Europe, in the UK, to reimpose lockdowns to prevent the transmission. So is there reason for us to be concerned?
Well, based on the reports coming from the UK, where it was initially identified, and of course the others followed suit, it was proven to be more infectious than the current or the initially identified strain circulating in most of the countries. It's 40 to 70% infectious. That is the estimate of the experts in the UK. And but they are saying, and based on their initial studies, that although it is more infectious, mas nakakahawa, it doesn't have a major effect as far as yung ability to elicit protective antibodies from people who probably recover from an infection or hopefully will be vaccinated by any of these new vaccines coming out. Because the changes, although it affects the spike protein, ito yung part ng virus which enables it to attach to the human cell para makapasok po. And of course to multiply and replicate. Although it affects that particular region, hindi po to major. And since the vaccines actually induce antibodies to the whole spike protein, no? Ang changes kasi na na-identify is only parts of the spike protein, hindi yung buo. We still expect the current vaccines to work.